Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and this is a very special podcast, and we're going to be reviewing what are the natural solutions to myocarditis and other heart conditions, such as congestive heart failure, atrial fibrillation, and I'm very excited to do this presentation. There's going to be a PowerPoint I'm going to walk you through explaining what the medical profession conventionally defines what myocarditis and other heart health conditions are. We're then going to explore the most common drugs prescribed for myocarditis, atrial fibrillation, and other heart conditions. What are some of their just awful, risky, scary published side effects and their black box warnings? And then what nature has proven successful at reversing myocarditis, plants, vitamins, minerals. I'm going to show you those, and I'm going to walk you through those research studies. If you know somebody impacted by myocarditis or heart conditions of any kind, then you should forward this podcast to those you love. If you know somebody diagnosed with any of those conditions, you can download the entire PowerPoint I'm about to show you at the resources tab at the drardisshow.com and just download it, save it. It's free, and you can email it, review it yourself if you have been diagnosed with myocarditis. Myocarditis, though, just for definition, myocarditis is a Latin term, and myo is Latin for muscle, cardia or cardia is heart. So you have heart muscle, itis is inflammation. What I found shocking that many of you may not know is the word myocarditis only became popular in our age, in our modern era, in 2021, when the COVID-19 mRNA vaccines were first introduced. There was this very rare thing called myocarditis that was occurring within 5 to 14 days of the COVID-19 mRNA vaccines, particularly more so in teenage boys. And the CDC even reported on that in 2021. I've done countless presentations on it. Dr. Peter McCullough, the cardiologist, was traveling the world with me, testifying in state capitol buildings of the effect of myocarditis from these shots that he, as a cardiologist, had never really seen in his entire career. And I actually talked to two other long-time, multi-decade cardiologists who had never even seen a case of myocarditis in their careers. So imagine my shock when I decided to go do my own research into myocarditis. Do you know when myocarditis was ever first coined a term to summarize symptoms of heart damage? It was only a descriptive term of the side effects of antivenom in a snakebite victim. And the guy who created antivenom for snake bites, his name was Albert Calmet, and he was being paid by Louis Pasteur and the Pasteur Institute in Paris, France. In the 1880s, Louis Pasteur sent him to Saigon, and then he was given 10 king cobras to create antivenom for the first time to king cobra venom. And he described a symptom that only occurred in people after giving them antivenom from a snake bite. When you administer antivenom in a shot form, he described in 1886 a condition called myocarditis. For the first time ever, was a descriptive side effect of what he called serum or blood sickness. So antivenom has this thing called serum sickness, which is a side effect that after you administer antivenom for a snakebite victim, on day 5 to 14, they will develop a condition called myocarditis as a part of serum sickness. So for those of you who know who I am, I'm called the venom guy all around the world. And there's a reason. So I was very shocked to learn about myocarditis way back when. Then, of course, if you've read my book, Moving Beyond the COVID-19 Lies, wait, hold on. I did something. If you haven't read the book, Moving Beyond COVID-19 Lies yet, you may not understand the references to venom anyway. But snake venom was in every COVID-19 mRNA vaccine in the research studies by those who were just given the Nobel Prize in Medicine for making them. So to see myocarditis showing up as a side effect of these new mRNA vaccines that have snake venom phosphodiesterase in them, of course myocarditis was going to be a side effect. How do you think they make antivenom? They make it from snake venom. Okay. All right. But myocarditis, I'm going to dive into here because there's natural solutions to myocarditis that you can actually see with a biopsy. You can reverse all the damage to the heart called myocarditis and confirm it with a biopsy of the heart You can confirm by day 14 you can cure myocarditis. And one singular plant was proven to do this in 2020 or 2021. And I'm going to show you that plant here later on. All right, so anybody with myocarditis, heart conditions, you're about to learn some really cool stuff, and I'm very excited. All right, so let's dive in. Here's my PowerPoint that I'm going to walk us through answers to myocarditis and heart conditions. This is our QR code. You can scan it, put your email in, and we'll notify you of any of my podcasts coming up. And I only do one a week. So if you would like to be notified of where they are, when they're coming, what I'm releasing, that's where you do it. All right, myocarditis, Cleveland Clinic, which is a reputable hospital in Cleveland, Ohio. They have an online website, and on there, they have a whole article titled Myocarditis. So here we go. Myocarditis is inflammation of the heart muscle or myocardium. This inflammation weakens your heart muscle, making it harder for your heart to pump. This can be caused by viral infections or inflammatory conditions. What is it continued? Myocarditis is different from other types of inflammation because each kind happens in a different part of your heart. Pericarditis affects the sac your heart sits inside of. Did you know this? You have your heart, and then there's a sac it sits inside of called the pericardium. Pericarditis affects the sac around your heart. Endocarditis is an infection or inflammation of your heart valves. Rare types of myocarditis, they show you lymphocytic myocarditis, giant cell myocarditis, fulminant myocarditis, eosinophilic myocarditis. If you look to the right, you can see the highlighted red, big muscles of the ventricles of your heart, the large chambers of oxygenated blood that pushes the oxygenated blood to the rest of your body. You see the red inflammation there marking with an arrow what myocarditis is. Now, the CDC I mentioned earlier in the very beginning of this podcast announced in 2021 that myocarditis was happening to teenagers more than adults getting the COVID-19 vaccines by day 7 after the shots, the second shot. All right, so here we go. This is this year. I'm actually recording this in December of 2025. This happened to be in June of 2025. Did you know the FDA approved requiring an updated warning on the label of all mRNA COVID-19 vaccines regarding myocarditis and pericarditis following vaccination? And I just highlighted here, this is June 2025. It's very relevant info. Were you told vaccines were safe and effective? Were you told teenage boys and adults, male and female, were acquiring, many of them, myocarditis? Well, I'm about to show you the rates at which this was found out to be happening after the fact. Now, just so y'all know, the FDA knew this was going to happen in October of 2020. Before the COVID-19 vaccines came out in December of that same year, they published a document, the FDA did, that showed myocarditis they expected would be a side effect of the coming shots. If you want to know why I think they knew that, is because they knew snake venom since 1880 caused myocarditis. Thank you, Albert Calmette, who, by the way, also brought you the rabies vaccine and antivenom. Interesting. All right, here's the FDA. They're requiring now of COVID-19 vaccines to contain myocarditis and pericarditis, the sac around the heart being inflamed or damaged due to the COVID-19 vaccines. The purpose of this new communication safety requirement is to inform the public and healthcare providers that the FDA has required updates to the prescribing information for Comirnaty, which is the COVID-19 vaccine from Pfizer, and Spikevax, which is the name of Moderna's mRNA vaccine for COVID, to include new safety information about the risks of myocarditis and pericarditis following administration of mRNA vaccines. Again, I love that the FDA is calling these mRNA vaccines. If you've read my book, I show you the NIH actually admits there is no mRNA in any of the COVID-19 vaccines called mRNA vaccines. It's actually DNA plasmids. All right, so let's continue with whatever they're fraudulently posting here. The results of a study that collected information on cardiac MRIs in people who developed myocarditis after receiving an mRNA COVID-19 vaccine. This is the updated warning for myocarditis and pericarditis. The warning on myocarditis and pericarditis in the prescribing information for Comirnaty, the Pfizer COVID vaccine, Spikevax, the Moderna vaccine, has been updated to convey that observed risk of myocarditis and pericarditis following vaccination with the called mRNA vaccines has been highest in males 12 to 24 years old, to include the following new language. Incidence of myocarditis and or pericarditis during the period of 1 to 7 days following the administration of the 2023 to 2024 formula of mRNA COVID-19 vaccines was approximately 8 cases for every million people that got it. 6 months years old through 64 years of age, and approximately 27 people developed myocarditis per million doses in males 12 through 24 years of age. So for all people, male, female, and younger children, it's 8 cases per million got myocarditis and pericarditis, except in the 12 to 24 year age for males. It was 3 times, actually almost 4 times higher, the amount of myocarditis and pericarditis. Now, for those of you who have followed me for a long time, there's a direct correlation to how venom behaves in the human body with excess testosterone in teenagers. Testosterone enhances venom toxicity even in snakebite victims. So this is why I believe this is so clearly a known impact on males, particularly in the puberty area, 12 to 24, when they have the highest amounts of testosterone. And Peter McCullough and I were in studio during COVID-19, and he actually brought up the testosterone connection, and then I got to educate him on other stuff after that. But he actually saw the correlation also. It was published. Now let's dive into heart disease in general. Heart disease includes many diseases that affect your heart, but coronary artery disease is the most common and familiar one. Heart disease can lead to a heart attack, heart failure, cardiac arrest, stroke, and organ damage. What is heart disease? It's when your heart isn't working well. It has trouble sending enough blood, oxygen, and nutrients to your body in a way your heart delivers the fuel that keeps your body running. If your heart can't deliver that fuel, it affects everything your body systems do. Heart disease is the top cause of death in the United States in people from most ethnic backgrounds. Heart disease is usually ranked 1 or 2, number 1 causes of death, or number 2 causes of death in America. All right, here's the different types of heart disease as defined by the Cleveland Clinic. You have coronary artery disease, which is fatty deposits in your blood vessels, causing them to narrow the amount of blood going through them. Arrhythmias, abnormal heart rhythms. Heart valve diseases, valves that are too narrow or don't close right, reduce blood flow. Cardiomyopathy, cardio means heart, myo means muscle, pathy means disease of. They describe this as a stiff or thickening of heart muscle that can't pump the blood well. Then you have heart failure. It's another type of heart disease. Your heart can't pump blood enough to keep up with your body's needs. Then there's congenital heart disease, what you're born with. And then pericardial issues, a stiff or inflamed sac, pericardium around your heart, presses on your heart. This is from Springer Nature. This is an article titled Global, the whole globe, regional and national burdens of myocarditis before the COVID-19 vaccines from 1990 to 2019. The number of myocarditis incidents increased from 1990 to 2019 by 62%, from 780,000 in 1990 to 1,265,000 cases in 2019. The number of deaths from myocarditis increased by 65%, from 19,618 in 1990 to 324,490 in 2019. So this was an ever climbing thing, and it's at rates higher than ever right now. This is the Heart Failure Society of America in an article titled Heart Failure Facts and Information. How common is heart failure? Heart failure is a growing problem in the United States. Current estimates are that nearly 6.5 million Americans over the age of 20 have heart failure. One major study estimates that there are 960,000 new heart failure cases every year. Not only is heart failure a major problem affecting many people, heart failure is also a major killer. Heart failure directly accounts for about 8.5% of all heart disease deaths in the United States. And by some estimates, heart failure actually contributes to about 36% of all cardiovascular disease deaths. One study notes that heart failure is mentioned in 1 in 8 death certificates. 1 in 8 death certificates. What are the risk factors for heart failure? Well, they're on the screen. I don't know if I need to run through all of them, but these are the risk factors, they say, for developing heart disease or heart failure. High blood pressure, fatty deposits in your arteries, heart attacks, damage to the heart valves, Now pay attention to heart attack. The word for heart attack is myocardial infarction. Don't forget that. Myocardial, myo means muscle, cardio means heart, myocardial infarct, infarction. That is the medical term for a heart attack. You're going to see it later as a side effect of most of the drugs they prescribe for heart disease and myocarditis. The drugs have that listed as a side effect, which sucks. Okay. Damage to the heart valves or history of a heart murmur, heart muscle disease and enlargement of the heart called cardiomyopathy or cardiomegaly. Cardiomegaly is heart enlargement. Heart defects at birth, family history of enlarged heart, diabetes, obesity, sleep apnea, and severe lung disease. What is being prescribed by your medical doctor for myocarditis? All right, well, let's look. This is Johns Hopkins Medicine, hopkinsmedicine.org. Myocarditis treatment. Now, I need to explain and show you the very first statement. If you or a loved one were diagnosed with myocarditis after the COVID-19 vaccines, just know mainstream medicine says there is no curative treatment for myocarditis. I'm about to show you just one here in about an hour or less. It's going to be awesome. Wait till I show you what they figured out how to cure myocarditis caused by a virus in 14 days. Cure the heart. I'm even going to show you the heart slides of the heart being cured of myocarditis in 14 days with one plant nutrient. All right, so myocarditis treatment. Let's go back. We're looking at the screen here. These are the most common prescribed drugs for anybody diagnosed with myocarditis, which the medical profession tells you they can't fix. They cannot cure. All right, first one is ACE inhibitors like captopril, lisinopril, enalapril. All right, so ACE inhibitors lower blood pressure and help with remodeling of the heart muscle after myocarditis. Beta blockers, which you've all heard of, improve arrhythmias and help with remodeling of the heart muscle. Diuretics make you pee, help decrease fluid congestion in the body. Corticosteroids like prednisone reduce inflammation in the body. Let's first look at this ACE inhibitor called enalapril, probably one of the most common ones prescribed, that and lisinopril, right? All right, so what is enalapril? It's used alone or in combination with other medications to treat high blood pressure in adults and children at least 1 month old, according to drugs.com. Enalapril can also be used to prevent and treat congestive heart failure in adults. Okay, good. That's what it looks like. This is the black box warning. Just so you know, anybody on enalapril or an ACE inhibitor, just know it comes with a black box warning that if you discontinue this drug, so pay attention to me as you're watching the Dr. Ardis show and you're like, I don't want to be on this drug anymore when I'm about to show you what it does. You just need to know this black box warning. Discontinue enalapril as soon as possible when pregnancy is detected, since fetal toxicity, including injury and death to the developed fetus, can be caused by drugs that act directly on the renin-angiotensin system. So, I would like to ask you, if it kills babies in utero, how healthy do you think the drug enalapril is for you? If it kills babies in the uterus of its mother, how healthy do you think this chemical is in your body? All right, so let's look at enalapril, an ACE inhibitor drug for myocarditis. And we put a star next to this one. The most frequently reported side effects include congestive heart failure. Hold up. Enalapril is the number one drug, ACE inhibitors, prescribed for myocarditis. Read this. The most frequent reported side effects includes congestive heart failure, coronary artery disease. Hold up. Enalapril being prescribed to people with heart disease called myocarditis. The most frequently reported side effect by the medical doctor to the FDA or the drug maker is, I prescribe this to my patients. The most frequently reported back to the government side effect of enalapril, which is FDA approved, by the way, is congestive heart failure that they didn't have before, coronary artery disease that they definitely didn't have before, and then we'll continue. Cough, dizziness, postural dizziness. When you change position, you'll get dizzy. Fatigue, headache, hypotension, deadly low blood pressure, hypertension, stroke level high blood pressure, hyperkalemia, high potassium levels, and microalbuminuria and vomiting. The first two are my favorite. enalapril for heart disease patients called myocarditis. The most frequently reported side effects include the patient now has congestive heart failure from enalapril and coronary artery disease from your ACE inhibitor drug. Ask your doctor when you have myocarditis, or your son does, who's a teenager. Ask your doctor if congestive heart failure and coronary artery disease that are frequently reported, the most frequently reported side effect of enalapril when they recommend enalapril to you. Ask your doctor if congestive heart failure and coronary artery disease are right for you or your teenage son. When you get to the cardiovascular side effects, look at this. Up to 10% of people on enalapril report chest pain they didn't have before, called angina, edema, swelling in their legs and arms, hypotension, severe lethal low blood pressure, myocardial infarction. Enalapril, up to 10% of people diagnosed and prescribed enalapril. 1 in 10 people will have a heart attack. Myocardial infarction. I asked you guys to remember this a minute ago. Myocardial infarction means a heart attack. Enalapril causes 1 in 10 people to have a heart attack. Orthostatic hypotension. You ever heard of POTS? You stand up, you get dizzy. You roll over, you get dizzy. Hypotension, rhythm disturbances, tachycardia is caused by enalapril in 1 in 10 people. Now, after the FDA approved enalapril, knowing it causes heart attacks in people, look at what happened when medical doctors started prescribing it. This is where you get to the frequencies not reported. They don't know what the percentage of people are. We just know that since the FDA approved this drug and it's no longer in human trials where you get the 1 in 10 people in the human trials had a heart attack, for example, now that it's on the shelves and been FDA approved, medical doctors are writing in and complaining to the government that enalapril is causing atrial tachycardia, atrial bradycardia, atrial fibrillation. Enalapril is causing cardiac arrest. That's death, your heart stopped beating. And vasculitis, inflammation of your veins and arteries. Cardiac arrest, anybody? Hold up. How does enalapril, an ACE inhibitor drug for myocarditis, a heart disease, how is it possible the most frequently reported side effects above at the top of the screen is heart failure, congestive heart failure, coronary artery disease, and after the FDA approved it, doctors have said it's causing my patients to have tachycardia, bradycardia, atrial AFib, and some of my patients' hearts just stopped and they died or had to be saved with an AED device. Ask your doctor if cardiac arrest, coronary artery disease, and congestive heart failure are right for you when they prescribe enalapril to you or your loved one. Is that shocking to you? It better be. This is the liver. Look at this. 1% of all people, that's 1 in 100, put on enalapril. 1 in 100 will experience liver failure. That's hepatic failure. They'll develop hepatitis or jaundice. GI tract, 10% or more will experience nausea. Up in 10% or more will experience nausea. And then 1 in 10 will experience abdominal pain, diarrhea, and vomiting. Hypersensitivity section of side effects for enalapril includes angioneurotic edema of the face, extremities, lips, tongue, glottis, and or larynx or rash. So swelling parts of your face, mouth, you name it. The nervous system, dizziness in 10% or more people in the clinical trials for enalapril. You just became dizzy. I don't know. Are you excited about being dizzy? Those of you with low blood pressure, high blood pressure, where you're feeling dizzy, do you think adding dizziness is better? 1 in 10 will experience headaches, syncope, taste alteration, vertigo. 10% or more will experience asthenia, which is like, painful, weak muscles all over the body. Weak muscles all over the body, muscle wasting. 1 in 10 will experience fatigue. Sorry, we got to go back. Other side effects of enalapril. Look at this. You see, bottom right, herpes zoster is caused by enalapril. We put a patient on enalapril and then they develop shingles. That's what herpes zoster is. I'd like to ask you, how does enalapril cause shingles? I thought shingles came from a virus called the herpes zoster virus. Well, if shingles comes from the herpes zoster virus, is herpes zoster in enalapril? How the hell would it make a person have herpes zoster, shingles, unless inside enalapril tablets is that virus. The next thing I wanted to highlight was a positive ANA, anti-nuclear antibody. Do you know what that is? Anybody out there with an autoimmune disease? Anybody? Do you know that your medical doctor is looking on your blood test when you come in complaining about a rash all over your body, joint pain in your body, and they think you might have an autoimmune disease? Do you know what they're looking for in your blood? This positive ANA marker. Did you know enalapril, an ACE inhibitor for high blood pressure? Did you know that enalapril for heart disease that causes congestive heart failure, most frequently reported, coronary artery disease, and causes cardiac arrest? Do you know this drug also causes a positive ANA in your blood work? But do you know that your medical doctor, if any medical doctor on earth, but primarily rheumatologist, when they see a positive ANA report, do you know what they're going to blame that on? Any guesses out there? Autoimmunity is 100% of the time blamed on genetics. So you're going to be told you inherited this, whether you were diagnosed with lupus, fibromyalgia, Sjogren's disease, it doesn't matter. Whatever autoimmune disease they told you had when they found this, they're going to blame it on genetics. I'm sorry. If you were on enalapril before you were diagnosed with an autoimmune disease, enalapril is what caused your positive ANA in your blood work, not your mom and dad's genes. 1 in 10 will develop depression from enalapril. Enalapril causes depression. Blurred vision, anybody? Does that make your life better? More than 10% of all people on enalapril in the human trials develop blurred vision they never had before. And then conjunctivitis. Once the FDA approved it, now medical doctors around the world have written into the FDA that I put my patient on enalapril and they developed conjunctivitis. Pink eye is what conjunctivitis is. Hyperkalemia, excess potassium. Now respiratory. This is enalapril still. Did you know 10% or more of all people on enalapril will develop a persistent chronic cough? Did you know that 1 in 10 will develop bronchitis from enalapril? Notice they tell you dyspnea, shallow breathing, and pneumonia is caused by enalapril. I thought pneumonia was either caused by bacteria or a virus. How does enalapril, a drug you swallow, does it have pneumonia bacteria in it? Does it have pneumonia virus in it? How did you get pneumonia from enalapril for high blood pressure, an ACE inhibitor drug? How did you develop bronchitis? I thought that was caused by infections. Unless there's infections in the pill. Can you explain that to me? Can your medical doctor explain it to you? Ask your doctor if pneumonia is right for you, because 1 in 10 on enalapril will develop it. And then 1% of all people on enalapril will develop asthma. Oh, did you know that? 1 in 100? All right, let's keep going. After the FDA approved enalapril, pulmonologists started reporting, and cardiologists, my patient I put on enalapril now has blood clots in their lungs called pulmonary embolism, caused by enalapril. Pulmonary embolism and infarction, death of lung tissue. Pulmonary edema, water filling up in their lungs, enalapril causes. Upper respiratory infection, anybody out there dealing with RSV, reoccurring pneumonia, you name it, enalapril causes that. Kidney stress, 1 in 10 will develop increased kidney markers, creatinine levels, potassium, urinary tract infections. Anybody? 1 in 10 on enalapril will develop urinary tract infections from enalapril, an ACE inhibitor drug. Up to 10% will develop depression. That's enalapril. Ask your doctor if depression, congestive heart failure, coronary artery disease, cardiac arrest, herpes, zoster, chicken pox, shingles. Ask them if those things are right for you when they prescribe enalapril. And when they say, no, those symptoms are not right for you, say, well, then why are you giving me a poison called enalapril just because it's FDA approved? Do you not read the damn label? I think there's a better way. All right, we're still talking about myocarditis and health conditions and the most commonly prescribed drugs. Now we're to metoprolol. Oh my goodness, millions of people in America are on metoprolol. All right, metoprolol is a beta blocker that affects the heart and circulation, blood flow through your arteries and veins. Metoprolol is also used to lower your risk of death or needing to be hospitalized for heart failure. Pay attention to that statement. Metoprolol is also used, per drugs.com, to lower your risk of death or needing to be hospitalized for heart failure. Sounds good, doesn't it? That's metoprolol. Here is its FDA black box warning for metoprolol. Ischemic heart disease. Do not abruptly stop metoprolol tablets in patients with coronary artery disease. Severe exacerbations of chest pain called angina, severe worsening heart attacks called myocardial infarction, and ventricular arrhythmias have been reported in patients with coronary artery disease, especially right when they quickly, abruptly stop these. So I said earlier, be careful. Don't stop these immediately. They know they can kill you from heart disease if you stop them early. Now, remember, metoprolol is used to reduce your risk of dying from heart disease and being hospitalized for heart disease. Look at these damn statistics. These are from the clinical trial on humans for metoprolol. The cardiovascular side effects section of drugs.com for metoprolol reads, heart failure occurred in 27% of people from metoprolol. When we gave them metoprolol, they had heart failure. 1 in 3 people. 1 in 3 people also developed hypotension, systolic blood pressure less than 90. Bradycardia, heart rate less than 40 beats per minute, was 15% of all people. Hold up. This thing said it was supposed, metoprolol is to lower your risk of death and hospitalization from heart disease. 1 in 3 people in the trials before the FDA approved this thing, they approved it knowing this, by the way. 1 in 3 people had heart failure caused by metoprolol. So ridiculous. 1 in 10 in the human trials developed cold extremities, arterial insufficiency. They didn't pump enough blood from their heart to the rest of the body. Palpitations, a heart they could feel in their chest. First degree heart block. That's not good. Second or third degree heart block. Oh my God. Second and third degree, you go unconscious. You get real dizzy. You want to faint. Third degree, you're dead. Like you're in a coma. Your heart ain't working enough, man. Oh, look at the last one there. Cardiogenic shock in patients with acute myocardial infarction. That happens in 1% of all people, 1 in 100 on metoprolol. The others were 1 in 10 or higher. So absurd. Ask your doctor if cardiac arrest is right for you. Heart failure. Oh my God. So ask your doctor if heart block is right for you. All right. GI for metoprolol. Those of you on metoprolol, this beta blocker. 1 in 10 develop diarrhea, nausea, dry mouth, gastric pain, constipation, flatulence, heartburn, abdominal pain, and vomiting. Retroperitoneal fibrosis in the lungs and in the abdomen. It's awful. Respiratory, 1 in 10, shortness of breath, wheezing, and shallow breathing. Nervous system, 1 in 10 will develop dizziness, vertigo, stroke from metoprolol, and headaches. 1 in 10. For 1 in 10 people going to their pharmacy at CVS and Walgreens to get metoprolol for their heart arrhythmias and heart disease, 1 in 10 will have a stroke from metoprolol. Ask your doctor if strokes are right for you when you have heart disease or myocarditis that they give you metoprolol for. Now, after the FDA approved it, many medical doctors said that put my patient on metoprolol like the FDA recommends, and they developed short-term memory loss from metoprolol. Now, Alzheimer's is first loss of short-term memory. And people that start experiencing that, they'll be called early onset Alzheimer's. Well, what you're learning here is metoprolol causes early onset dementia. Ask your doctor if memory loss is right for you when they prescribe metoprolol. For the skin, pruritus and rash, sweat increase, which is not a big deal. I don't mind sweating. It must be really excessive sweating to be reported in a trial. Psychiatric, 10% will develop depression from metoprolol. Oh, we can just prescribe them an antidepressant. Furosemide, otherwise known as Lasix, all of you. This is a diuretic. We're still talking about drugs for myocarditis. What is furosemide, known as Lasix? It is a loop diuretic used to treat fluid retention, edema in people with congestive heart failure. So to remove water from the body, you take a water pill, they call it. That's Lasix, furosemide. Now, this is the black box warning for patients who are prescribed furosemide. Furosemide is a potent diuretic. It'll make you pee a lot. If given in excess amounts, it can lead to profound diuresis with water and electrolyte depletion. You're going to need Hydrate Complete from Dr. Ardis's website. Hydrate Complete, you better have it. Furosemide side effects included these. Metabolic section. 1 in 10 will develop hyponatremia, that is low sodium. Hypochloremia, that's low chloride. Notice every patient in the hospital is given sodium chloride in a bag. That's because most of these heart patients are on these drugs that cause you to be low in both of those. Hypokalemia, low potassium. Blood cholesterol is increased. Blood uric acid is increased. That's called gout. And then after the FDA approved furosemide Lasix for heart disease and water retention, many medical doctors have reported what you see there on the screen. Hyperglycemia, high blood sugar. Diabetes developed from metoprolol. Ask your doctor if diabetes is better than just having heart disease and myocarditis. Metabolic alkalosis, hypercalcemia, too much calcium. Hypomagnesemia, that's too low of magnesium, which causes heart disease. Dehydration, you need our Hydrate Complete. Tetany, serum potassium decrease. Blood level of potassium goes down. You're going to get muscle cramps, heart cramps, leg cramps, you name it. Bartter syndrome, whatever that is. Electrolyte disturbances and blood calcium decrease. For the blood, hemoconcentration and thrombocytopenia. Ask your doctor if blood clots are right for you. For the genitourinary tract, Lasix causes glycosuria, blood sugar excess in your urine. Bladder spasm, urinary retention, urinary incontinence is caused by Lasix. Deafness is caused in 1 in 100 people on Lasix. Deafness, 1% of all people will go deaf, caused by Lasix. After the FDA approved Lasix to go to the market and medical doctors started prescribing it, this is what's been reported around the country to the FDA about this damn drug. I put my patient on Lasix because they had high blood pressure and myocarditis, and they developed weakness. My patient suddenly died. Notice sudden death as a side effect of Lasix, reported by medical doctors after prescribing it to their patients who weren't dead before they prescribed it. Ask your doctor if sudden death is right for you when they prescribe Lasix. And then when they ask you, where'd you hear that? Say, I learned it from drugs.com on the Dr. Ardis Show. Hearing disorders. Anybody out there losing your hearing, having tinnitus, being told you need hearing aids or a cochlear implant? Hearing loss is caused by Lasix. I had perfectly good hearing until I was prescribed Lasix for myocarditis and high blood pressure. Ask your doctor if going deaf, paying thousands of dollars for new hearing aids every year, or a cochlear implant is right for you when they prescribe Lasix. Nervous system. Tinnitus is caused in 1%, 1 in 100 people on Lasix develops tinnitus. Hyperosmolar coma. Ask your doctor if coma is right for you, because 1 in 100 will develop that from Lasix. Now I want you to look at the next. Hepatic encephalopathy, liver swelling leading to brain swelling, headaches, fainting, and loss of consciousness, drowsiness, lethargy, and a sweet taste. Loss of consciousness, you're either awake or you're not, you're in a coma or dead. These are side effects of Lasix reported after the FDA approved it. Cardiovascular, did you know 1 in 100 will develop cardiac arrhythmias from Lasix? Did you know systemic vasculitis, inflammation of your arteries and veins, orthostatic hypotension called POTS, angina, anyway, thrombophlebitis, these are blood clots, acute hypotension, circulatory collapse. What in the world is that? Your whole heart and cardiovascular system just stops working? Shock, hypertension, thrombosis, blood clots, orthostatic blood pressure decreased. Okay, that's Lasix. Ask your doctor if sudden death is right for you. Prednisone. Everybody knows about prednisone. This is the corticosteroids recommended for myocarditis and heart inflammation. Millions of Americans are on this right now. Today, millions just swallowed this morning. All right, so prednisone, drugs.com, is a corticosteroid medicine used to decrease inflammation. Prednisone is used to treat allergic disorders, skin conditions, ulcerative colitis, Crohn's disease, arthritis, lupus, psoriasis, asthma, chronic COPD. That's what it looks like, pill form. What are its side effects? All right, general side effects. The most commonly reported adverse effects associated with corticosteroid use include fluid retention. That's going to require a Lasix diagnosis that we just ran through for you. Uh, Alteration in glucose tolerance. Diabetes, anybody? So you're going to now become unable to balance blood sugar. You're going to become a diabetic from prednisone. High blood pressure is caused by prednisone. It's one of the most commonly reported adverse side effects of prednisone is developing high blood pressure you didn't have before. Prednisone causes that. Behavior and mood changes. Anybody need a therapist or feels like they're missing out by not having their own therapist or a psychiatrist? If you want one, start taking prednisone and you'll have behavior and mood changes. Increased appetite and weight gain. If you just feel like you're too skinny, if you started to realize there's an anorexic problem in Hollywood when you watched Wicked, when you watch the main actresses, you're like, wait a minute, what happened to these people? They need to put on some weight. Maybe I need to put on some weight. Prednisone will help you do it. These are some of the metabolic changes in the human body that occur when you're putting them on prednisone, and you can read them. I'm not going to go through all those. Let's get to the heart ones. After the FDA approved prednisone for use in all patients prescribed by medical doctors, did you know that bradycardia is being reported by medical doctors after putting their patient on prednisone? Now they have bradycardia, changes in their heart rhythm, cardiac arrest. I prescribed prednisone. My patient took one tablet and they died. Their heart stopped. They reported that to the FDA, to the drug manufacturer. But look at the list. Prednisone being prescribed to everybody with heart conditions and myocarditis, bradycardia, cardiac arrest, cardiac arrhythmias, cardiac enlargement, circulatory collapse, and congestive heart failure are side effects of prednisone already known by the FDA. We'll go down farther. Cardiomyopathy, developing heart disease in premature infants is a side effect of prednisone. Myocardial rupture following a heart attack. Your heart literally ruptures open. Parts of your heart muscle rip open after a heart attack because of prednisone. Ask your doctor if prednisone, reported to the FDA, marked on the package inserts as causing cardiac arrest, cardiac arrhythmias, enlarged heart, congestive heart failure, circulatory collapse, heart disease in premature infants, and a rupturing, ripping open heart muscle from a heart attack caused by prednisone is right for you. I don't know about you, but when they say heart disease is number 1 or 2 killer in America, now you're starting to figure out why. The 4 drugs they prescribed everybody with supposed heart symptoms and myocarditis, every one of these drugs have cardiac arrest, congestive heart failure, and death as side effects. Okay. Now you know why it's showing up on 1 out of every 8 death certificates. Notice on your death certificate, they don't write. Let's go back. Notice they don't write. Patient had a heart attack and their heart ripped open, their heart ruptured because of prednisone. No, they don't write that on your death certificate. They say the patient died of heart disease. No, they didn't. They died from cardiac arrest from prednisone. Their heart stopped from prednisone, but they don't write that on your death certificate. Cardiac arrhythmias, cardiac enlargement, congestive heart failure caused by prednisone is never going to get written on a death certificate. They're just going to write heart disease. Can't make the drugs look bad. No, just keep funding this damn racket. Adrenal insufficiency, you can look at all the problems associated with it. Number of sperm increased or decreased. You can create infertility with prednisone. Menstrual irregularities, you name it. Hyper and hypothyroidism are listed on there. Moon faces is another side effect of prednisone. I can't imagine anybody on earth going, you know what, Mom? When I grow up, I want to have a moon face. Well, if you do, prednisone will do it. Did you know, for all of you out there who are scared to develop cataracts, did you know that after the FDA approved prednisone, many, many medical doctors have reported to the FDA that when I wrote the prescription of prednisone for my patient, when they came back, they had already started developing cataracts as a side effect of prednisone. Did you know that was a reported side effect of prednisone? Did you know prednisone causes cataracts? Did you know prednisone, also look at it underlined, did you know that prednisone causes glaucoma? Which is, by definition, the next thing they wrote, increased intraocular pressure. That is what glaucoma is? Water buildup in your eyes, and your eyes can't focus, double vision. How many of you have prism glasses right now to handle your double vision caused by increased eye pressure called glaucoma? And how many of you are on prednisone? Pancreatitis, anybody? It's known to be caused by prednisone. Musculoskeletal. Anybody out there afraid of osteoporosis? Did you know prednisone causes osteoporosis? Did you know prednisone causes fractures of your long bones called your femur? You know, you're told you fell and broke your hip, but in reality, your hip broke and then you fell. And what's the risk there? Death from pneumonia from the surgery in the hospital. Is the number one cause of death for elderly? All right, well, osteoporosis leads to the fracture of long bones, and both of those are caused by prednisone. Did you know that? Tendon ruptures, and particularly the Achilles tendon. How about spinal compression fractures? Do you know how painful that is for your vertebrae in your spine to collapse and pinch on your spinal nerves? There are people put on fentanyl patches for how painful that is. And then they inject concrete into your spine. Did you know prednisone causes that to happen? It's not normal aging. It's normal aging with prednisone. Now look at these that I highlighted for the nervous system. Did you know prednisone causes dementia? It's not just Alzheimer's, people blamed on genetics. Prednisone causes dementia. It's been reported by MDs since the FDA approved it. Impaired cognition, increased motor activity. Do you know what that is? Tremors, involuntary tremors. That's Parkinson's. Prednisone causes tremors in Parkinson's. Now look at the one I highlighted under there. Paraplegia? Paraparesis? You can't feel parts of your body? Prednisone does that. Oh, look at that. Neuritis. I didn't even highlight that one. Neuritis. Meningitis caused by prednisone. Those are painful. Extremely painful. Psychiatric prednisone side effects. Once the FDA approved prednisone, medical doctors started prescribing it, then the patients taking it would come in and report to their doctors these things. I didn't have anxiety before. I didn't have delirium before. I didn't have depression before I started prednisone. Now I have hallucinations, severe psychiatric symptoms. I have long-term memory loss. That's worse than your Alzheimer's stuff. Schizophrenia is a side effect of prednisone. Verbal memory loss. You can't speak. This is aphasia. Bruce Willis just retired from Hollywood for this. Withdrawal behavior. Any of these sound good for you? Anybody out there have loved ones they know dealing with any of these who are on prednisone before they were diagnosed with these and were told these were normal signs of aging or genetic? Skin. Anybody out there want alopecia and lose your hair? Did you know prednisone does that? Did you know prednisone causes horrific cystic acne all over the body? It's right there. Acne, acneiform eruptions, acne. But I'm going to highlight alopecia because losing hair sucks for everybody. Thin, fragile skin. Anybody out there cutting themselves, just touching the doorknob or their casing of their doorway? Just tap it and their skin rips open. Yeah. Did you know that prednisone causes that? It's not normal aging, but many old people are on prednisone for years that cause thin, fragile skin and thinning scalp hair as reported by drugs.com. Package inserts. Did you know that? Now let's talk about, those are the 4 most common drugs prescribed for myocarditis and heart conditions. Also why Dr. Ardis doesn't really like drugs as the first line of defense to help people. Remember remdesivir? You were told it was safe and effective for COVID. And I coined the phrase, run death is near. Yeah, how'd that pan out? There's only one reason why more Americans in America, why more citizens in America died during COVID-19 than any other country. For the whole first year of COVID, only Americans were injected with remdesivir. And that was the highest death toll period in hospitals around the world, was during the first year of COVID, when America was the only country allowed to use remdesivir, which was proven to kill 53% of all people. The FDA approved that drug in October of 2020. Anthony Fauci said before it was approved, it was proven safe and effective against Ebola. Why do these people continue to lie to you about how safe and effective these drugs are? And why does the FDA put their stamp of approval? By the way, the FDA approval, I just read an article this week, and I just have to say this. I thought the FDA approval was truly a non-biased review of drugs, findings, and research studies, confirming the safety profile of drugs. And then if the FDA determined it was a safe enough drug, they would put their stamp of approval and allow medical doctors to start prescribing it. Do you know, I just read this week that the FDA approval process is not an approval process by the FDA as much as it is a negotiation of the FDA with the drug maker company. Did you know that? Did you know that when Ozempic and Wegovy just had added to their black box warning, they just had added to their black box warning cancers, heart attacks, blindness? Do you know the FDA had to negotiate with the companies to put those warnings on their package inserts? I did not know that's how this worked. I thought the FDA told them what to do. Did you know this was called negotiations between the FDA and the drug companies? Yeah, don't trust that FDA approval process, people. It is bought and paid for. It's called paid endorsements, and the FDA gets paid to endorse the product. This is why the drug companies are the only ones being sued after they're brought to market, and the FDA doesn't get sued. All right. What research finds helps myocarditis and heart conditions naturally? I'm very excited to dive into this. The first thing we're going to talk about is a substance called guggul resin extract. It comes from a tree called the Commiphorus muckle tree out of the Middle East and India. I really love this natural substance. It's like the sap or gum from this tree. This journal from 2002 or 2003 is titled Cardioprotective Activity of Synthetic Guggulsterones of an E and Z type in a drug-induced myocardial ischemia rat study. So they're going to use a drug to induce, or a chemical to induce, myocardial infarction or heart disease. And then they're going to see, does guggulsterones, even a synthetic form, can it heal those hearts? So the effects of drugs on heart ischemia, so heart attack or death of heart muscle. Administration of the drug that causes the heart attack, called isoproterenol, to induce ischemia in rats, increase the serum levels of something called CPK, GOT, GPT, and alkaline phosphates, respectively, at these numbers. So they injected the drug. They see these markers, which are markers of the heart disease model. Then they write, however, treatment of ischemic rats with guggulsterone isomers, the E or Z form, at the dose of 50 milligrams per day reversed the blood levels of the heart markers from heart damage called CPK, GOT, GPT, and alkaline phosphatase. Guggulsterones reversed it. Guggulsterones, or the mixture of both, significantly reversed the biochemical parameters in the blood and hearts as compared to the levels of ischemic group. So they created the trauma to the heart with a drug. They induced heart disease like they could have with any of the 4 drugs I just showed you: Lasix, enalapril, furosemide, which is Lasix, or prednisone, like I just showed you. They induced the heart disease, and then guggulsterones reversed it. Guggulsterone isolated from the Commiphora muckle tree against isoproterenol-induced or drug-induced heart disease in experimental animals, and these effects on heart and blood parameters at the same doses. The increase in xanthine oxidase and lipid peroxidase in damaged heart of the rat was protected significantly by the treatment with guggulsterones and by both forms, what they called E and Z guggulsterone. Guggulsterone protects LDL, what they call bad cholesterol, against oxidative modifications, turning LDL cholesterol to being something bad, and protein components induced by copper-2, which is not the copper we have. We only recommend copper-1 form because copper-2 is toxic. The protection provided by the guggulsterone and the 2 isomers against heart damage may be due to the ability of the drugs to inhibit, the test drugs being the guggulsterone, to inhibit the generation of oxidative free radicals that are induced by the bad toxic drug called isoproterenol treatment in the rats that cause the heart disease. So let me just put it to you another way. If you're on Lasix If you're on prednisone, if you're on enalapril, or any of these 4 drugs I just walked you through that are known to cause heart attacks, cardiac arrest, coma, death, you name it, if you're on those drugs that induce heart damage, glucosterones you should be on. It's been proven to reverse it, even in rats. Drugs that cause heart disease may induce hypothyroidism that contributes to the development of heart attack in rats or heart disease. It's been reported that glucosterone enhanced the synthesis or making of thyroid hormones and tissue oxygen uptake. So even when you use drugs that hurt the heart, those drugs also affect the thyroid, they're telling you, and cause hypothyroidism. But glucosterones actually reverses the thyroid problems too in research studies. Pharmacological studies, drug trial studies show glucosterone caused decrease in the brain levels of catecholamines and dopamine B hydroxylase activity in rats that protect against dementia, Parkinson's, damage to the brain. That's what glucosterone prevents. Present data demonstrates that they're studying 2 forms of glucosterone, E and Z. The present data demonstrated that the Z form of glucosterone at the same dose exerted more heart protection and antioxidant activity of the drug, is what they wanted the readers to know. We used 2 forms of glucosterone. The Z form was even better than the E form. Now, this is another research study about the heart protective nature of glucosterones in Google resin. And this is a study from 1984, the role of Google in the management of ischemic heart disease. 50 cases were treated with Google in the dose of 6 grams a day in 4 divided doses. The initial average blood cholesterol before the trial was 248. Remember, normal is 200. Cholesterol they collected at the beginning was at 248 on average. It was reduced to 235 on average after 4 weeks on Google. It went down to 214 after the second, it went down to 224 in the second month. Then it went down to 214 in the third month. Then it went down to 205 in the fourth month, just using Google. So cholesterol levels, I continue to talk about. The reason why the Google resin extract we just released for everybody as a supplement was to address the many concerns around the world about cholesterol. It is so good. It's been known for, this is 1984, by the way, this research, this is 40-something years ago. On statistical analysis, it was highly significant, Google's ability to lower cholesterol. The percent reduction was 5.3%, 9.57%, 13%, and 17% at the end of the first month, second, and third, and fourth months, respectively. Thus, the cholesterol lowering effect of Google was found to be highly significant. In this trial of Google in 50 patients of ischemic heart disease, this trial, 10% of cases, read this, they take 100 people, 10% of them were cured of ischemic heart disease in 4 months of taking Google. They did not have precordial pain, and the blood cholesterol and ECG were within normal limits after 4 months. 10%, 1 in 10 were completely cured of ischemic heart disease with Google resin alone. Now, that may not seem significant, but watch this. 10% were completely cured of their heart disease in just 4 months. Name a drug that's ever done that. 0. FDA approved or not, no drug has ever reversed ischemic heart disease in 4 months, ever, in anybody, much less 1 in 10. The percentage of relieved patients, those who have no more heart pain, was 60% in these cases. There was improvement in the precordial pain, and any one of the serum cholesterol, any of the cholesterol levels were normal, or the ECG, echocardiogram, were normal. 60% of people experienced relief of all their pain associated with ischemic heart disease, and their blood levels were normal, and their ECG was normal. But they weren't cured, but they were relieved of all their pain. The percentage of improved patients was 20%. In the cases in which there was only improvement in the pain, but no improvement in the precordial pain, and no improvement in cholesterol or the ECG. But 20% saw improvement. So this is the list. I just want to show you all this. This is amazing. They took 100 people with ischemic heart disease and just gave them Google for 4 months. 5 of them were, it's 50 people. 5 of them were completely cured of all their heart problems. That's 10% of all of them. The pain in many of them, 30 out of 50 were completely, all their pain was gone, and their blood cholesterol was normal, and their ECG was normal, but they weren't considered cured. That was 60%. That is a total of 70%. And then another 10 of the 50, which is 20%, were also improved. Like their pain was all gone, but they didn't see real improvements in their cholesterol or their ECG. Add that up. 10%, 60%, 20%. That is 70% of 100%. That's 45 out of 50 people. There ain't an effing drug in the world that has those numbers. That's FDA approved. Only 5 out of 50 people had no changes in their pain, cholesterol, ECG. Anybody with heart disease that's on any of the drugs I just showed y'all, y'all should be pissed right now that your cardiologist has not put you on Google Resin. They've known this for 40 years. Your job now is to go teach them. That should be shocking to all of you. All right, now this is a research study from 2007. The therapeutic effects of Google and its constituent called, its component inside called Google sterones. And this is only about cardiovascular benefits. Most of the subsequent animal studies were done in rats. Consistent results were obtained with Google sterone at doses ranging from 5 to 100 milligrams for every kilogram of body weight. Google sterone at 25 milligrams per kilogram lowered blood cholesterol and triglycerides by 27% and 30% respectively after a treatment period of just 10 days. This is awesome. There ain't no statin drug on earth that does that ever. But Google does it. And just so y'all know, please don't think this is weird that I'm showing you a rat study. Every drug approved by the FDA that you can go get in a pharmacy was first tested in mice and rats before they gave it to humans. And they actually tell you why they do that. Every mouse, every rat has the same exact genes that a human does. And I quote, "We studied drugs in mice and rats because if it's going to happen in a mouse or a rat, it is going to happen in a human." So they go into mouse and rat studies, then they move into humans. And then the FDA approves it or doesn't approve it. Okay, so these numbers here, if it happens in a mouse or a rat, it's going to happen in a human. In Triton-fed rats, the Google sterone at a dose of 50 milligrams per kilogram significantly reduced blood cholesterol levels. In cholesterol-fed rats, Google sterone at a dose of 5 milligrams per kilogram for 30 days reduced the lipids, which is LDL, and very low density VLDL levels. So the bad cholesterol lowered significantly in 30 days. In addition, it was found that Google sterone treatment increased lipolytic enzyme activity as well as receptor-mediated catabolism of LDL, which is called your LDL. Your body's able to break it down so it doesn't accumulate in your arteries. Google sterone does that. Y'all should be excited about that. Now, I'm done with Google, but Google Resin is in 2 supplements I'm about to show you. One's called Cardio Flow. It's the first ingredient in it for the heart conditions. I created that formula. And then the second one is our Google Resin extract by itself. It's just in a capsule form. So we just released that about a month ago. Very exciting. Or a couple months ago from this recording. All right, now we're going to talk about one specific mineral that literally I go around the world and people call me the magnesium guy. Wait, you're that magnesium doctor. Am I? Okay, that's me. I love magnesium. All right, so here's magnesium, the role of dietary magnesium in cardiovascular disease. Now, listen to just some of these highlights about magnesium and heart disease. If your cardiologist does not have you or your loved one who has heart disease of any kind, does not recommend magnesium, fire the dumb doctor. They are incompetent. And they do not deserve your time, your copay, your allegiance. In 1988, Ellen introduced the term chronic latent magnesium deficiency as an individual with a reduction in total body magnesium, but with a blood total magnesium content with an accepted reference interval. So there's groups and governments and health advisory boards that say this much magnesium is what should be in someone's blood. This guy, Ellen, this researcher defined in 1988, there's a term called chronic low-level magnesium deficiency. that's an individual who has a reduction in total body magnesium, but with blood level magnesium content that is inside of a normal range on a blood test. But their whole body has lower than it should have. Chronic latent magnesium deficiency is prevalent in humans, which indicates that many individuals could have an inadequate magnesium status that could contribute to the occurrence of cardiovascular disease. Even if it looks like they have enough magnesium in their blood, they don't have enough in their tissues, like in their heart, arteries, veins, you name it, and they will develop heart disease. In 1993, a second experiment, magnesium deficiency, was induced in humans by feeding a liquid diet that contained 0.5 millimoles of magnesium, an amount that is near what some individuals might routinely consume in their diet. Most people don't get enough magnesium. This deficiency increased angiotensin-induced plasma aldosterone. Now, I have to explain this. Aldosterone is a hormone your body makes. When you don't have enough magnesium in your body, aldosterone goes up in production. Do you know what causes hardening of arteries disease that leads to aneurysms and strokes? It's called aldosterone. The higher the amount of aldosterone, the higher the hardening of your arteries becomes, and the faster they harden. In fact, low salt intake causes elevated aldosterone, and it is directly correlated to heart disease and high blood pressure. In the late 1990s and early 2000s, a series of metabolic unit experiments were conducted to test the hypothesis that naturally occurring inadequate, not enough intake of magnesium resulted in negative magnesium balance and inadequate magnesium status, such that metabolic and physiological changes occurred that responded to magnesium supplementation. So in the 1990s and in the early 2000s, they were doing research studies to evaluate how much magnesium is in these people's blood and in their body and in their diet. And then what kind of diseases are they developing as a result? And they're telling you their metabolic, their hormones, their metabolism, their body physiological changes all responded to taking magnesium supplements. If your cardiologist or your medical doctor is not recommending magnesium, fire them. When consuming diets comprised of conventional foods providing between 100 and 118 milligrams, these changes included adversely affecting cardiovascular function. Notice, they're telling you, they didn't get enough magnesium. They developed cardiovascular dysfunction during submaximal work, an increase in both supraventricular, these are the ventricles of your heart, the big chambers, and supraventricular plus calcium retention and ventricular beats. They saw a decrease in urinary calcium excretion and increased calcium balance, and thus increased calcium retention. They saw a decrease in urinary excretion of phosphorus and potassium. They saw altered oxidative metabolism and induced heart rhythm changes, including AFib. When you didn't get enough magnesium, the patients developed AFib. How many cardiologists are recommending AFib? For AFib, magnesium. How many cardiologists instead are recommending Eliquis, a prescription drug known to cause heart disease and death and strokes? Yes, it's a published side effect. That is a prescription FDA-approved drug. How many cardiologists, when you have AFib, is recommending magnesium to you? Also, during this time, epidemiological disease studies and clinical evidence that chronic low-level magnesium was associated with high blood pressure. How many people do you know see a cardiologist for high blood pressure and are recommended magnesium? Not very many. Instead, they tell you to take Lasix. Did you see the list of side effects of Lasix I just showed you? In addition to healthy populations, a low magnesium status has been associated with cardiovascular disease in patients with health problems such as diabetes. Low magnesium correlates to the populations of people with diabetes and chronic kidney disease. Anybody out there seeing a nephrologist, a renal kidney specialist? Have they ever recommended to you for your kidney disease magnesium? And if not, you should fire them. Or at least take them to study, and if they don't want to read it, then fire them. If they don't want to believe research, fire them. If they don't want to listen to you as you listen to me, let them go. For example, systemic reviews and collections of studies have found an inverse relationship between, an inverse meaning one's high, one's low, have found an inverse relationship between magnesium intake and stroke. The more magnesium people took, the less strokes they had. Really? How many stroke patients do you know who have high blood pressure, stroke level blood pressure, are being put on magnesium by your cardiologist? How many of you knew, those of you not told to take magnesium, increase your risk of stroke? Thank you, cardiologists. When I say you should fire them, you should definitely fire them if they're not recommending magnesium to everybody. There's also an inverse correlation between blood magnesium and all-cause cardiovascular death. Any reason why someone dies from heart disease is directly correlated to whether or not they're taking magnesium. The amount of magnesium in the body, the lower it is, the more deaths there are. The more magnesium there's less cause of all deaths caused by heart disease, particularly in those with chronic kidney disease and end-stage renal disease. Ask your nephrologist and cardiologist if magnesium is right for you, because it is. Trials found that magnesium supplementation decreased both systolic and diastolic blood pressure. What? ACE inhibitors, anybody? Anybody on captopril, enalapril, lisinopril for blood pressure? Beta blockers, calcium channel blockers. Did you know magnesium supplementation decreases both upper and lower numbers of blood pressure? And they did that in 8,600 people. The decrease was particularly effective at doses of higher than 400 milligrams a day for 12 weeks. What do I recommend? A minimum 500 milligrams every day for your life. Do you see why I'm called the magnesium guy? A prospective study with a total of 149,000 patients found that a sufficient diet intake was associated of magnesium, enough magnesium in their diet was associated with lower risk of atherosclerotic, hardening of their arteries, cardiovascular disease, and death in those that have type 2 diabetes. So now we're looking at endocrinologist as your diabetes specialist. Call an endocrinologist recommending magnesium to you to prevent heart disease and death. And if not, you should fire them. Ask me how I really feel. I don't like dumb doctors. Okay, let's not say they're dumb. I don't like ignorant doctors. Ignorant being you have chosen not to be educated, and instead you decided to be unlearned. Okay, well, don't be dumb. Be learned. Go study. This is another research study titled The Connection Between Magnesium and Heart Health, Understanding Its Impact on Cardiovascular Wellness. Cardiologists, pay attention. Kokubo and his team, medical researchers, assessed the dietary magnesium intake of 85,000 Japanese participants aged 45 to 74 years old, free of cancer or cardiovascular disease. In a study conducted by Abbott and his group, they studied a group of people, 7,000 men aged 45 to 68. Both studies discovered, look at the number of people. That's 95,000 people. Both studies discovered a link between a lower incidence of heart disease with a higher intake of magnesium. When I said if your cardiologist isn't recommending magnesium or tells you not to do it, boy, they tell you not to do it, you should fire them anyway. Nobody likes dumb doctors prescribing dangerous stuff. Zhang, another medical researcher, reported results from the Japan Collaborative Cohort study, which involved 58,000 Japanese adults between the ages of 40 and 79, whose dietary magnesium consumption was measured by food frequency questionnaires. Food has magnesium in it at varied amounts. Food magnesium intake was found to be inversely linked with death from coronary heart disease and ischemic strokes. If your cardiologist isn't recommending magnesium, fire them. My God, how many people need to do the research? The more magnesium people eat, the lower the risk of death from heart disease, cardiovascular disease, coronary heart disease. A study was conducted by another medical researcher on 55 participants with a cardiac response rate of more than 120 beats per minute and had AFib. Of them, 75% received treatment with magnesium sulfate and 25% received a placebo. Magnesium sulfate was given and it led to a conversion to sinus rhythm and a reduction in pulse rate. What? Hold up. It improved atrial fibrillation and lowered blood pressure and the pulse rate? Oh, ask your cardiologist if magnesium is right for you. And if they say no, you say, doctor, I'm sorry, but you're not right for me anymore. Davey and Tubner, the two more researchers, observed similar outcomes in a prospective randomized double-blind placebo-controlled experiment on 199 adults with fast atrial fibrillation, AFib, who were admitted to the emergency room. Magnesium was given to 102 participants of the 199, while a placebo was given to 97. It was found that the magnesium group had a higher chance of achieving a heart rate of less than 100 beats per minute and changing to sinus rhythm, normal rhythm of the heart. Oh my God. This has been done in hospitals. How come your cardiologist doesn't know this? 200 patients undergoing their first coronary artery bypass grafting. You've heard of bypass surgeries for the heart. Cardiologists, pay attention. People out there who have had heart graft bypass surgery. If you've had a bypass or know somebody who has a heart bypass surgery, had a heart attack, blockage, had to have bypass surgery, watch this study. 200 patients undergoing their first heart bypass surgery were examined by Torman, a researcher and his team, and randomly assigned to two different groups. In the group that was administered magnesium, atrial fibrillation after surgery affected only two patients. Two patients, which was 2% of the 100 patients. Whereas in the control group, it affected 21. 21% of them had AFib after the surgery was done. But only 2% had atrial fibrillation after the bypass surgery for those who received magnesium. Thus, it was determined that magnesium supplementation during the period before surgery, as well as during the early phase after surgery, so the week after surgery, significantly lowers the risk of AFib following bypass surgery. Anyone out there had a loved one or themselves had bypass surgery, later diagnosed with AFib from the surgery, and still never been told to take magnesium? Fire that cardiologist. This research was supported by an experimental study done in Iran, in which 160 adult individuals underwent heart surgery with normal blood dynamics and normal sinus rhythm were studied. The results showed a major difference in the occurrence of all arrhythmias between the magnesium-treated group and the untreated group. Arrhythmias, anybody? Tachycardia, bradycardia, any of you got that? AFib, magnesium, numero uno. Relationship, this is the Journal of the American Heart Association, by the way, in case you don't know about magnesium. And if your cardiologist doesn't recommend magnesium and the American Heart Association is publishing this kind of crap, this is 2020. Relationship between dietary magnesium intake and the incidence of heart failure among older women. If your cardiologist isn't recommending magnesium, when I say fire them, you should have already fired them. You should be angry and then hopeful after you've heard this info. Potential mechanisms of the association between magnesium intake and heart failure hospitalizations can be several. Potential mechanisms, what's associated between people going to the hospital and what's the magnesium intake correlation. Low blood levels and low dietary magnesium have been associated with risk factors of heart failure, such as coronary disease, left ventricular hypertrophy, insulin resistance, diabetes mellitus, hypertension, and atrial fibrillation. Is that amazing? Which over time could lead to heart failure. Low levels of magnesium can lead to all of that. If your endocrinologist and cardiologist aren't recommending magnesium, you know how I feel. A one-time infusion of elemental magnesium has been shown to acutely decrease left ventricular filling pressures. More blood can get into the heart, the ventricle that pushes oxygenated blood to the rest of your body, just with one dose of magnesium given to the vein. The relationship between magnesium intake and heart failure, but not heart failure with ejection fracture issues, may be in part explained by the vascular dilation effects of magnesium. Magnesium relaxes muscles, so they dilate. The arteries dilate, they get bigger, which mirrored the past vasodilator trials with ACE inhibitor drugs. What, magnesium did the same thing ACE inhibitor drugs did? Yep, they did. And angiotensin receptor blockers, beta blockers, and hydralazine and nitrates, other drugs, and improved outcomes in patients with heart failure with ejection fraction issues. Ask your cardiologist if magnesium is right for you. Based on the U.S. recommended daily allowance of dietary magnesium at 320 milligrams per day, I recommend 500, for non-pregnant women above 30 years of age, the implications of our study are large, as about 75% of all postmenopausal women in this multi-center, multiracial study have a magnesium intake of 272, which is less than 50 milligrams of what they recommend at the top, 320 milligrams. and that's below the recommended daily allowance levels. And our results suggest a quarter of the postmenopausal women in this study are at increased risk of developing heart failure on the basis of their dietary magnesium intake alone. Because they're not taking enough magnesium, we believe they might have heart failure more than anybody, older women. Atherosclerotic risk in communities cohort study demonstrated that low level of magnesium was associated with the development of incidence of heart failure. It is plausible that the habitual high intake of magnesium may eventually increase your blood levels of magnesium as a reflection of higher body stores to provide protective effects against heart failure. The more magnesium you swallow into your stomach, the more will get into your bloodstream, the more protection for heart failure you will have. Now we're going to get to something found in licorice root extract. We're still talking about myocarditis, heart disease. We're talking about natural antidotes. I've shown you what drugs do and how dangerous they can be. This is the natural antidotes proven by medical science. All right. Pharmacological studies of Glycyrrhiza glabra. Now, that is a fancy word for licorice root. Licorice is the root and rhizome of the Glycyrrhiza plant, which belongs to the family Leguminosa. This plant has been recognized worldwide as an important medicinal herb since ancient times. Glycyrrhiza is derived from the ancient Greek term glykos, meaning sweet, and rhiza, meaning root, means sweet root. Licorice constituents also exhibit, check this out, licorice root. Licorice root, its nutrients inside of it exhibit anti-arthritic properties, anti-arrhythmic properties, which is a heart condition, antibacterial or antiviral, and steroid-like anti-inflammatory. Whoa, like prednisone. Similar to the action of hydrocortisone, which is a corticosteroid, like prednisone. This is due in part to the inhibition of what's called phospholipase A2 activity, an enzyme critical to creating inflammation in the body. It reduces it. That's what licorice root does. As well as indirectly, licorice root inhibits platelet aggregation. You know what platelet aggregation is? Anybody worried about blood clots? Licorice root prevents blood clots. Anybody on blood thinners out there? Warfarin, heparin, Coumadin. Licorice root does that. Now we're going to dive into wormwood. Wormwood is another plant. Its fancy science name is artemisinin. The effects of artemisinin, I put above it wormwood, on ventricular arrhythmias, big heart chamber arrhythmias, changes in your heart rhythm, AFib, bradycardia, tachycardia, in response to left ventricular afterload increase in mRNA, microRNA expression profiles in rats. For this study, 70 rats were randomly divided into 7 groups. Group 1 was the control group. They had a sham surgery. They didn't even have a surgery. It was a fake surgery. Group 2 was a model group that underwent transverse aortic constriction surgery called TAC, and they do that in humans. So they had a heart surgery on these rats, group 2. Then groups 3, 4, 5, and 6 were administered artemisinin, wormwood, at 75 milligrams, 150 milligrams, 300, and 600 milligram per kilogram after the heart surgery, respectively. That's the amounts that group 3, 4, 5, and 6 were given. So there was a sham group. Group 1 didn't have a surgery. It was a fake one. And then the second group of rats actually had the heart surgery. Then group 3, 4, 5, and 6 were given various amounts, increasing amounts of wormwood called artemisinin. And group 7 was administered a drug called verapamil at 1 milligram per kilogram before the surgery. And the wormwood was given before the surgery too, sorry. A ventricular arrhythmia, arrhythmia of the heart, was calculated to evaluate preventative effects of artemisinin and verapamil, the drug, on mechanical or surgery-caused ventricular arrhythmias. The high throughput sequencing-based approach provided DMs that were altered by artemisinin pre-treatment between group 2 and group 4. They saw changes with the artemisinin group. All right, now, hold on. I want to focus on something here. The average, look at the top, the average ventricular arrhythmias of groups 3, 4, 5, and 6, and 7 were significantly reduced compared with those of group 2. Group 2 just got the surgery. But the ventricular arrhythmias of groups 3, 4, 5, 6, which were given artemisinin or wormwood, were significantly reduced compared with those of group 2. Group 7 was given the drug verapamil. I want you to read together. Group 2 was a model group that underwent the surgery. Groups 3, 4, 5, and 6 were administered artemisinin and wormwood at 75, 150, 300, 600 milligrams before the surgery, respectively. What they found in this study was arrhythmias were less in the artemisinin and wormwood groups and the verapamil group. But what they found in this study was that verapamil, the drug, caused atrial ventricular blocks, which leads to feeling like you're going to pass out, faint, or even die. AV blocks, that's wormwood. Now, let's keep going. This is another one from Bentham Science, another medical journal on wormwood. Extracts of wormwood alleviates myocardial remodeling, the healing of the heart from damage of heart disease. The same drug they used in the previous rat trial to induce heart disease, they're using it again here. They use isoprotenolol, was injected subcutaneously under the skin to induce cardiac fibrosis, scar tissuing of the heart. Proteomic analysis was performed after 4 weeks of wormwood treatment. So then they evaluate the rats after giving them 4 weeks of wormwood. Echocardiogram was used to evaluate cardiac function and structure, which is exactly what they use in humans. The analysis identified 227 different expressed proteins, including 119 upregulated and 108 downregulated proteins. These proteins were identified as the core proteins targeted by wormwood for improving the heart's rehealing, they call remodeling. In the animal study of the drug-induced heart disease rat model, we found that artemisinin administration, wormwood, significantly ameliorated or resolved cardiac dysfunction. And wormwood reduced collagen production, the scar tissue, by suppressing all of those inflammatory markers in the myocardium, in the heart muscle. Similar beneficial effects of wormwood were consistently observed in the tumor growth factor beta 1 group treated primary cardiac fibroblast. In conclusion, this study validated that artemisinin, called wormwood, attenuates ISO, the drug-induced myocardial fibrosis. And remember, I just showed you 4 heart drugs that cause these kind of heart problems. And wormwood can reverse it and improves cardiac dysfunction. Our findings can be exploited clinically to pave the way for artemisinin, wormwood-based combination therapies for the treatment of future heart failure. Ask your cardiologist today to read these research studies and recommend wormwood, Google, magnesium for you. All right, now, this is one of my favorites I'll talk about is cinnamon. This is PubMed.gov. This is from 2021. Beneficial effects of cinnamon and its extracts in the management of cardiovascular diseases and diabetes. Let's read together. Cardiovascular diseases and diabetes are the leading cause of death worldwide. Numerous lines of findings have elucidated that cinnamon has beneficial effects against cardiovascular diseases in various ways. Cinnamon does. Cinnamon includes this benefit: endothelium protection inside your arteries and veins, regulating of your immune response. Cinnamon lowers blood lipids, that's your cholesterol numbers. Cinnamon is an antioxidant. Cinnamon is anti-inflammatory. Cinnamon suppresses vascular smooth muscle cell growth and mobilization. Cinnamon represses platelet activity and thrombosis, that reverses blood clots and inhibits angiogenesis, the development of them. Furthermore, emerging evidence has established that cinnamon improves diabetes, a crucial risk factor for cardiovascular diseases. In cinnamon, the nutrient that they know cures cardiovascular diseases and makes all of those improvements we just named, they found the substance inside of it is called coumarin. And this article, I just want to show you coumarin content in cinnamon. What's the deal? I need to show you from this article. Read with me. Coumarin is a natural blood thinner from which the drug warfarin, its generic name Coumadin, is derived. Did you know that Coumadin, also called warfarin, that people pay millions of dollars for in the form of copays and health insurance payments or out-of-pocket expenses for this blood thinner? Did you know coumarin is found in cinnamon is what they turned into the drug called warfarin and Coumadin? They literally discovered that inside cinnamon is a substance they named coumarin. All they did was change the R in coumarin to a D, and you got Coumadin. Did you know cinnamon did that? It's amazing. Cinnamon. Did you know this? Blood thinners are useful in preventing blood clots, which prevent heart attacks and strokes. That's why warfarin, Coumadin are given. Did you know cinnamon is what they made those drugs from? Ask your doctor if cinnamon's right for you. Now, hold up. Can nicotine cure myocarditis? Yes. Yes, it can. This is from Scientific Reports. Read with me, and then let me show you the heart images of a cured myocarditis patient in 14 days with just nicotine. Dose dependent. This means the more you give, the more protective it is. Dose dependent protective effect of nicotine in a mouse model of viral caused myocarditis that they induced by Coxsackie virus. Let's read together. Now, this study is incredible. The aim of this study was to investigate the dose-related effects of nicotine in alpha-7 nicotinic acetylcholine receptor agonist in a mouse model, which is what murine means, mouse, in a mouse model of viral myocarditis. Now, I repeat, if it happens in a mouse, it happens in a human. That's why they study all drugs in mice first. So this is a mouse study where they're going to inject a virus into the mouse. It's going to cause myocarditis, and the virus they chose is called Coxsackie virus. Okay. Nicotine was administered at doses of 0.1, 0.2, 0.4 milligrams for every 2.2 pounds of body weight, called a kilogram. And they gave that to these mice 3 times per day for 7 or 14 days consecutively. The effects of nicotine on survival, myocardial disease changes, heart damage changes, cardiac function, and inflammation levels, called cytokine levels, were studied. So they gave 3 different doses of nicotine, 0.1, 0.2, 0.4 milligrams for every 2.2 pounds of body weight, every day for 7 or 14 days. And they wanted to know, what was the survival of the mice from myocarditis that we induced with the virus? What's the disease of the heart process? So they're going to cut pieces of the heart and look at it. Cardiac function, how does the heart perform on an ECG? And then what's the inflammation levels in the blood after giving nicotine? The survival rate on day 14 increased in a dose-dependent fashion. The more nicotine we gave, the more those mice survived myocarditis by day 14, and was markedly higher in the 0.2 and 0.4 milligram group. Well, if you look above, the only other amount was 0.1. Then in the infected untreated group, there was a significantly better myocarditis reversal and survival rate for the mice we gave nicotine to in 14 days than in the group that we caused myocarditis and told them not to take nicotine. So if you have myocarditis, or if your loved one does, and your cardiologist told you not to give your loved one nicotine, remember this study. You are preventing them from curing their loved one's myocarditis. Treatment with high-dose nicotine reduced the myocardial inflammation, the heart inflammation, and improved the damaged left ventricular function of the infected mice. How about that? The mRNA expressions and protein levels of tumor necrotic factor and the other inflammatory markers were significantly reduced in a dose-dependent manner in the nicotine-treated groups compared to the infected untreated groups. Nicotine dose-dependently reduced the severity of viral myocarditis through inhibiting the production of pro-inflammatory cytokines. Now, in the study, they actually showed this picture. I have to show you. You'll see on the left, A, B, C, and D are marked. Top left is A, B, C, D. So A is the first day they measured before giving nicotine how much myocarditis damage is there of heart muscle. You're seeing just a thin slice of heart muscle from these animals with myocarditis. The arrows they're pointing on the screen are pointing to these purple areas where the damage to the heart muscle is caused. D, where I put a star, look to the right, figure 1, D I highlighted. And I'm going to read this to you. I can't really see it very good. It's a little bit far from me. That's okay. Representative histopathology of the mice treated with the 0.4 milligram nicotine. There is a small foci of inflammatory cellular infiltration where the arrow is found in the area. But if you look at the other areas, look, there's in C, which is the 0.2 milligram group, you'll see there's only 2 focal points. In B, you will see a whole bunch of 1, 2, 3, 4, 5 arrows you'll see there. A is where myocarditis was created on day 1. Look how big the damaged areas are. Doesn't matter the amount of nicotine in B, C, and D, it reduced the size, the number. As you went up higher, you saw reductions in the size of damage there. Our results, read the bottom line. Our results indicate the stimulation of alpha-7 nicotine receptors with nicotine treatment dose-dependently improved survival, reduced myocardial inflammation, and improved the impairment of left ventricular function of mice induced by Coxsackie virus myocarditis. Now, this is a study that came out from 2021, and it is titled Phytochemical, Plant Chemical, Pharmacological Activities, Drug Activities, and Ethnomedicinal Uses of Nicotine Tobacco, Nicotina tobacco, which is tobacco. A comprehensive review, and I want to highlight something for you here, because I'm talking about nicotine curing myocarditis, and I just showed you that, and that was done in 2021 also, that research study I just showed you. So if you have myocarditis, ask your doctor if nicotine is right for you. But look at this. Nicotine tobacco, called tobacco, is a popular plant in human history and economy, and it's a notable fumitory plant. In addition to the alkaloid nicotine, tobacco contains other major chemicals such as flavonoids, tannins, saponins, terpenoids, cardiac glycosides, cardiac means heart, phenols, steroids, polypeptides, and resins. Now I want to focus on cardioglycosides. Cardiac means heart. What are cardiac glycosides? This is from clevelandclinic.org. I had to show you this. What are cardiac glycosides? Cardiac glycosides are medicines that can help people with certain heart conditions. You take them as either a tablet, liquid, or capsule. What are they used for? Cardiac glycosides are medicines, prescriptions, that help your heart muscle have stronger contractions. They also slow down how quickly your heart beats when you have certain heart conditions. Let's keep going. Researchers are exploring the use of cardiac glycosides, also found in tobacco, to keep several types of cancer cells from multiplying. Wow. Let's keep going. Cleveland Clinic also reports, what do cardiac glycosides treat? Cardiac glycosides treat several heart diseases. Heart failure. What? Tobacco can treat heart failure? Yep, it has cardiac glycosides. This is why the pharmaceutical industry hates tobacco. Heart failure. Healthcare providers have used digoxin, which comes from the foxtrot tree or herb, for heart failure for 200 years. That comes from a plant like tobacco. Did you know cardiac glycosides in tobacco and foxtrot, foxglove, the herb, the plant? It's also used for atrial fibrillation. Cardiac glycosides. Providers have prescribed digoxin from foxglove for atrial fibrillation for more than 50 years. I repeat, tobacco has cardiac glycosides in it. Now let's keep going. These are all the chemicals that they highlight are in tobacco. Watch this, read along. These substances have a number of biological activities. This is the tobacco plant, including antimicrobial, antibacterial, antifungal, antiviral, antioxidant, reduces inflammation. Tobacco's antihelminthic, that's antiparasitic. Those are big worms, like tapeworms. Anti-nociceptive, that's amazing. Anti-Alzheimer's, what? Tobacco's anti-Alzheimer's? Whoa. Peripheral nervous system activities, central nervous system activities, how the brain works, and cardiovascular system activities. Did you know tobacco has nutrients in it that the heart needs to work properly, your brain to work properly, and your peripheral nervous system to work properly, and it protects the brain from Alzheimer's? What? If you know someone who has been diagnosed with myocarditis or AFib, ask your cardiologist today if nicotine patches are right for you, and then show them this study, which I just highlighted there at the bottom. You can grab that. Remember, you can go download this entire PowerPoint at the resources tab of the Dr. Ardis Show. Here's our CardioFlow product highlighting on the screen in the supplement facts panel. The first ingredient is Google resin, which we just showed you helps with myocarditis and all heart conditions. Here is Google resin by itself. Yes, I would recommend CardioFlow and at least one capsule of our Google resin extract to help improve cholesterol levels, prevent heart disease, improve myocarditis, and reverse it. In our foreign protein cleanse, I highlighted on the screen licorice root, wormwood, known as artemisinin, and cinnamon are 3 of the first 4 ingredients in foreign protein cleanse, and why I made that. Foreign protein cleanse is named foreign protein cleanse because all viruses are foreign to the human body. All viruses are also proteins. So this is called foreign protein cleanse. Notice the myocarditis research study, they injected a virus to create myocarditis. What did COVID and the COVID-19 vaccine do? Caused myocarditis. So to protect the heart, I created foreign protein cleanse. These are just 3 of the amazing ingredients inside of it. Also happen to fit in to help with myocarditis and heart inflammation and blood clotting. This is our magnesium complex. 4 capsules, 400 milligrams. You'll see the various forms: magnesium malate, magnesium citrate, magnesium aspartate. Ask your doctor if magnesium is right for you. It is. Scan the QR code. If you enjoyed this, please share this far and wide. It's the number 1 or number 2 killer in the world is heart disease. Myocarditis is becoming ever more popular and more diagnosed, and everybody needs to know these truths. This is our new book. Scan the QR code. Go get it. It's at the Dr. Ardis Show. It's an Amazon bestseller, has been for years. It's now in Spanish. It's in French. It's also coming to you in Polish very soon. And we're very excited about that. All right. Let me get out of that screen there so you can just look at me. I hope the year 2026 is an amazing year for you. I hope the holidays were an incredible period wrapping up the year 2025 as it has been for me. God bless you. I love you. Thank you for your support. Thank you for hanging out with me. And if this has provided any value to your life, I'd love to hear from you. So let us know. Any comments at info@thedrardisshow.com. We appreciate all that you do. I honor you and your support of us. Please share these messages far and wide. I believe that nature wins. And I think we've been able to show you that for all those that developed myocarditis in recent years, only to find out now that myocarditis is a black box warning for the COVID-19 mRNA vaccines, even though the FDA knew that beforehand. These are some of those solutions I believe you should either go ask your doctor about, or you, now that you have the research studies, you now can make a confident decision of what you need to add to your daily life to improve your heart's function and protect it from heart disease or death. I'm Dr. Ardis. We will see you next time on The Dr. Ardis Show. Thanks for watching this week's episode. Visit thedrardisshow.com/follow for my official social media channels and free healing resources. Beware of fraud accounts. Neither I nor my company will ever ask you for money, crypto, or personal information through your social media or DMs. Like this video and share with a friend. And if you're not already, subscribe and follow along so you don't miss any updates from me, the only real Dr. Bryan Ardis. And remember, nature always wins.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.